Hi everyone! Today we will be discussing medical terminology regarding anatomical terms. So you'll use these terms a lot when you're writing your medical notes, and they're primarily used to describe things on the body. So you can describe where a mole is in relationship to where it is located on the skin, and overall it's just going to be really important, so let's get on to it. So the first thing you'll need to know is the anatomical position. It's the universal stance you'll use to precisely describe the location of the features. So imagine that there is a mole on the patient's leg. You'll always be imagining the anatomical position that the patient is in to describe this in your notes. So what is the anatomical position? It's basically this 4 points over here, where the patient is standing upright, arms at the side, palms forward, and their feet together. You'll always be referring to this when describing where something is on the body. So if the patient's anatomical position is placed face down, it's called the prone position. If it's placed face up, it is called the supine position. So one way that you can imagine using this in clinic is imagine that the patient is laying down on their back and the doctor is pressing down on their stomach and the patient has tenderness in their abdomen. You can describe this saying that in the supine position, patient feels tenderness when palpating the abdomen. The next terms that we're going to discuss is directional positions. So these directional terms are used to describe the position of the external structure. So imagine that you're looking at the body as a map. These terms, left, right, superior, inferior, proximal, distal, medial, lateral, these are just ways to describe the north, east, west, and south of the body. So the first thing we'll discuss is left and right. The first thing that we're going to learn for directional positions is left and right. What is left and what is right when you're describing something on the body? It's pretty simple. The thing that you need to remember is that we're using the patient's perspective to describe left and right, not your own. So if you look on these two models on the screen, the one on the left is incorrect because it's using your perspective and not the patient's, whereas the right one is correct. So if I wanted to ask you where this point is in relationship to the navel, you would say that this point A is left to the navel. Pretty simple. The next terms we'll be describing is to describe the front and back of the body, also known as anterior and posterior. Anterior, also known as ventral, means pertaining to the front of the body. Posterior, also known as dorsal, means pertaining to the back of the body. You'll find that doctors tend to use these interchangeably. So anterior, dorsal, ventral, posterior. It's just best to know both ways of describing the front and back of the body. That way you won't get flustered in clinic. So let's do two examples on how you would use these terms. Let's say that the patient has a rash right here. How would you describe this? You would say that this rash is located on the dorsal side of the left knee. All right. And let's say that I ask you where the navel is in relationship to the body. I would say that the navel is located on the anterior side of the body. So that is how you would use the terms anterior and posterior. So the next terms we're going to be discussing is how to describe up and down the body. To describe it, we're going to use the terms superior and inferior. The term superior means above or towards the head, whereas inferior means below or towards the feet. So for example, I'm going to draw one red X here and one blue X here. I would say that this red X is superior to the blue X, or vice versa, I would say the blue X is inferior to red X. So proximal and distal is trying to discuss where the point is that we're trying to describe and if it's farther away from the body or closer to the body. So one thing that you have to remember is proximal and distal is only used when referring to points on the same limb, whether it's the arm or the leg. So in this example here, if I'm trying to describe this point in relationship to this point, I cannot say that they're proximal or distal to each other because they're not on the same limb. I can use proximal and distal to describe these 2 points because they're on the same arm. So, what is proximal and distal? Proximal means that the point is closer to where the limb inserts into the body, whereas distal means that it is further to where the limb inserts to the body. So, for example, if I wanted to describe blue X to red X, I would say blue X is more proximal to red X. Likewise, you can say that the elbow is more proximal to the wrist, or the wrist is more distal to the elbow. It's just trying to describe how far it is away from the body. The next 2 terms we're going to discuss is medial and lateral, and it's all in relationship to this midline. It's an imaginary line that splits the body in half in the center. So medial means that the point is closer to the midline, whereas lateral means that the point is farther away from the midline. So you can say that the navel is right on the midline, and you would say that the hip is lateral to the navel. The last pair of terms that we're going to be discussing is deep and superficial. Superficial means that it is near the surface of the body, whereas deep means that it's farther away from the surface of the body. For example, you could say that the heart is deeper than the rib cage, since the rib cage is closer to the surface of the body. So before we end this part on directional positions, you can definitely use multiple terms to describe one area of the body. Just like in real life, you won't just be describing something as north or west or south. You can say that something is northeast or something is southwest. So when you're in clinic, just remember to keep these terms in mind. The next section that we're going to be discussing is anatomical planes. It's cutting up the body into left, right, front and back, or top and bottom. So whereas before, when we were using directional terms to describe the external structures, we're going to use the anatomical planes to describe the internal structures. There are 3 planes that we're going to be focusing on. They are sagittal, frontal, and transverse. So sagittal splits the body from left and right. Frontal splits the body from front and back, whereas transverse splits the body horizontally, top and bottom. These planes don't necessarily have to be right in the center, they can be off center. So you might be wondering what anatomical planes can be used for. One common way they are used is in medical imaging, such as the PET scan, the brain MRIs, or the CAT scans. So let's use the PET scan as our first example. If you look at the PET scan, you can see that they are using a frontal cross-section in order to image the body, whereas the brain MRI is using a sagittal plane in order to see the body, and the CAT scan is using a transverse plane. Use different planes for different purposes. For example, in the brain MRI, many pictures that you'll see is using a sagittal plane because there are just some things that you can see easier, especially around this area, the medulla and the pons area, that you can see more clearly with a sagittal plane. And you'll be using this when you're looking for images and labs in the medical note. So this pretty much concludes our anatomical terms that we're going to be discussing in this lesson. Just remember that you can use many terms to describe where one thing is in relationship to the body. And good luck on your journey on becoming a medical scribe. Cue dramatic music.